Hi, good morning everybody. Welcome back to my channel. Today we are going to discuss about breast augmentation and breast reduction. Now, breast augmentation is actually a procedure where we increase the size of the breast, and breast reduction is, as the name implies, to reduce the size of the breast. So breast augmentation can be either we use a natural product or we use a synthetic material. Examples of a natural product or natural material that we use for breast augmentation is fat tissue, or this is what we call as fat grafting. That means we take fat from one part of the body and we transfer it to the breast, and this fat is used to increase the volume of the breast. Now, when you use synthetic material for breast augmentation, there are many in the market, and of course the most well-known one is silicone, and we use this as a breast implant. And it can also be sometimes it can be hyaluronic acid, so this is what we call as HA. So this is what we call as a fillers. Sometimes people use it to inject into the breast. There are also a lot of cases that I see when people talk about breast augmentation, they go to uncertified places, and for this center what they use is sometimes they use a non-medical grade silicone, and also sometimes they use oil like paraffin oil, and this can cause a lot of complications, and patients come and see me and asking me to solve these problems. Now, when you talk about breast reduction, is a procedure that we do to actually reduce the size of the breast. So when you want to reduce the size of the breast, usually this is because patients start to feel pain over the back and over the neck because the breast size is too large, and sometimes they start to have changes in the spinal column, and all this will lead them to long-term feeling of pain and discomfort. So when we do a breast reduction, this pain and discomfort will actually go away, and also the shape of the breast will be nicer, becomes more taut and perky. Now, usually people, when we go back to breast augmentation, people will ask me, so if let's say I want to do a breast augmentation with silicone, so what are the types of material or what are the types of products that is available in the market? Now, in Malaysia there are a lot of brands that is available, but two most popular one at the moment is either Mentor, and also the newer one in the market is what we call as Motiva breast implant. Alright, so these and then these implants come in various shape and sizes, and there are also what we call as anatomical implant and also round implant. The difference is anatomical implant, the shape is more like a teardrop. It means it's bigger in the bottom and thinner in the top, so it follows the natural shape of the breast. Whereas round implant is something that is round. So still, when you talk about implant, we talk about the placement of the implant. Sometimes the implant can be put underneath the muscle. This is called subpectoral. The implant can be put underneath the breast tissue. This is called subglandular. Sometimes people put underneath the fascia. It's called subfascia. Also, most of the time, what we do is we put in between a combination of layers. That means a dual plane implant. So that means either a subpectoral and subglandular. And then what are the long-term complications of implant? So implants is when you put a breast implant, this is actually a procedure, a medical procedure or a surgical procedure by itself. So surgical procedure, like any procedures, there's always a risk of infection, bleeding, you know. And then since we put an implant which is a foreign material, so there is a risk of a long-term effect like extrusion of the implant, malposition of the implant, infection in the long-term run, and implant can also be actually deflated if there is a major trauma to the child. But other than this, it's actually fairly safe, and implant has been shown to be in use in 1995, and then have gone through several regulations with FDA and all that. There is actually a recent issue with implant about what we call as a lymphoma or one type of tumor that's associated with implant. That one I'm going to talk in another video. So that is why you need to subscribe, and whenever I have a latest news and updates, I'm going to put it here. Now, for breast reduction, actually is a procedure whereby a plastic surgeons, what we do is we reduce a portion of the breast, and then the remaining breast and the nipple will be repositioned to a newer location, and this, you get a newer shape of the breast tissue. And this is actually, breast reduction is ranked as one of the highest with regards to patients and surgeon satisfaction. So they feel a complete and immediate difference immediately after the procedure. Okay guys, until the next video, I'm going to share again a lot more videos. Please subscribe to my channel, and this channel is purely for educational purposes, and I hope you can distribute the information to as many people as possible. Alright, thank you.